Hello and welcome to another edition of the Ask Dr. Pickel show, where we help people find answers for chronic conditions, chronic health problems. And today we've got some interesting information. We're going to go over basically 7 drugs that can damage your gut. Gut health, and when I say the word gut, this is your digestive organs and your elimination organs, your stomach, your small intestine, your large intestine, and a lot of the associated organs and areas there. So, when we talk more about that, or even when we look into this more, especially in a lot of the more recent research, we see how important the gut is and how much it plays a role in the health of our entire body. With the gut, we're seeing how it's now in research called the second brain. It's 75% of our immune system is there, so it plays a giant part in our immune system function. The bacteria that live in our gut, that we need them, and we have to have them. They play a giant role in so many things, and their number is astronomically high. Also, the gut, its effect on emotions and mood. So the gut plays a giant part in so many things, and we oftentimes can create more trouble by not caring for it and treating it properly. So we're going to talk about some things that can have detrimental effects on the gut, and dive into that right now. All right. So 7 drugs that affect the gut. So the first one, and you guys may already guess this, antibiotics. Okay. So antibiotics. Antibiotics, of course, the only role that antibiotics have is to kill bacteria. Antibiotics don't kill viruses. They don't kill funguses. They're meant to kill bacteria. The problem is our gut is loaded with bacteria. So if a person has a certain infection, they can take an antibiotic, and yeah, that may kill or bring down the populations of certain bacteria. But the thing we've got to ask is, why did that infection occur in the first place, especially if it's in the gut? Or even if it's in another part of the body. I mean, yeah, maybe if you cut yourself and you get an infection there, you've opened part of your immune system up and your system to external bacteria. But still, should your immune system be able to fight that pretty easily? And are there alternatives, things that maybe could help just as much? So we'll talk about that too. But the problem is when you take an antibiotic, of course, this kills a lot of the good gut bacteria, and the research is now showing that this has a profound effect on our good bacteria in our gut, and especially in younger ages. In fact, they're seeing in research now that children that take antibiotics, or babies that take antibiotics, this could change their gut health for the rest of their life. This could change. Just think that gut ties in, just like I talked about, ties into your nervous system, your immune system, emotions, so many things. The gut influences so many things. So if you change that early on in life, you can create all kinds of changes, problems. Antibiotics, and you can say, hey, I really haven't taken an antibiotic in a long time. Doesn't matter. Antibiotics can leave residues in your gut too, potentially, and this can continue to create problems. Also, we don't have to take an antibiotic to get antibiotics in our system. What are other ways we can get these into our system? Foods are of course, one of the biggest things. Soaps, these sterile environment type things. We're thinking so much now with all the corona stuff, that we need to have everything clean and everything sterile. No, actually, this is making things worse. You can't have a sterile environment. Our body's not set up to be sterile. We need these bacteria on the inside of us, on the outside of us. The problem is when our immune system drops, that's when their populations rise. Bacteria live in us day in and day out, and they act as scavengers, and they do all kinds of different jobs. So we need these guys a lot. And so if you've taken antibiotics over years, this can have a lot of effects on you and your gut and many areas of your body, because we need these beneficial bacteria, this flora, we call it, which is shown to influence mood and behavior, immune function. Actually, these bacteria even produce certain vitamins that we need. So very interesting stuff. So antibiotics are definitely number one. We need to think about it each time you take an antibiotic. Now, here's another side of antibiotics I didn't mention too, is we're using these antibiotics, or they have been used on many people over many years. The problem is bacteria, they adapt and change to these antibiotics. So now in a antibiotic saturated world, because again, not just taking them, but in pills and in foods and things like that, these bacteria are turning into what we call superbacteria. So now it's taking stronger and stronger antibiotics to try to kill off these bacteria, which is going to result in more antibiotic resistant bacteria and stronger medication. And now there's antibiotics out there that are extremely strong, but the side effect list is a mile long, and they're extremely dangerous because they can cause so many other health issues. So definitely look at potential options when it comes to antibiotics, and don't just take them willy-nilly for common problems. All right, what's our next one here is NSAIDs. And if you've never heard of NSAIDs, this means non-steroidal anti-inflammatory drugs. So what are these? These are like your aspirins, your ibuprofens, your Tylenols, all your typical over-the-counter. I mean, you can get prescription non-steroidal anti-inflammatories too, which are just usually higher dose non-steroidal anti-inflammatories. And what are people trying to do with these? You know, the thing is when a person takes these, the first thing you got to say is, well, why am I having to take this? What's going on? Because someone could be prescribed these, or we can just go to the store and get these. Let's say I have a stomach ache or a headache or feel a certain symptom. You can take these, but what is it doing? It may be decreasing inflammation, but what's causing the inflammation? That's the thing you have to think. That's the thing you have to focus on, because the thing is anytime you take these things, you are changing your body's physiology. You're changing certain things in your body. And these non-steroidal anti-inflammatory drugs, this is the number one reason for GI bleeds, gastrointestinal bleeding. Number one reason in the United States is due to non-steroidal anti-inflammatory drugs. In fact, interesting statistic, 103,000 hospital visits per year are due to this. And then how many deaths per year? 16,500 people die per year due to non-steroidal anti-inflammatory drugs, but you never hear about that, of course. The thing about it is these drugs will worsen a leaky gut situation. You know, the thing is they're going to start to cause malabsorption, maldigestion. They're hard on these stomach linings. Yeah, even, I mean, not only that, I mean, you know, how do we think, hey, you know, if I take enough of these, I can get a stomach ulcer, or I can get GI bleeds? That's because it's breaking down the wall of these organs. Not good. And then also, how does it affect my liver and my kidneys despite the gut? So again, these can have potential problems too. And you know, again, if somebody takes one every once in a while, yeah, you know, maybe you want to decrease some pain. I understand. I don't want people to suffer. But at the same time, you've got to find out the reason why you have inflammation, the reason why you have symptoms. All right. Now, number 3 is proton pump inhibitors and antacids. I see so many patients who are on these when they come into our office. They've been prescribed these so easily. I'd say the biggest thing that I'll see in a lot of what doctors are telling patients is your problem is you have too much acid. Your problem is you have too much acid. No. And it really, it's very frustrating. It's very, it's not even, the patients aren't even really told the truth of what's going on. Too much acid. If you look in a book, a medical textbook on, let's say, even physiology, high stomach acid, overproduction of stomach acid by the stomach, it would be extremely rare. It would be rare to never happening. How does this occur? We've got to look at what really is causing these types of symptoms, because they're treating symptoms. You can decrease the acid in the stomach, but why is the stomach acid high? So the thing is we have to have acid. If you don't have stomach acid, you basically cannot live very long. You can't digest food. So, when you eat food, food goes down to your stomach. Your acid in your stomach helps to break that down. And also that acid in your stomach activates digestive enzymes. It activates your gallbladder to contract, to release bile, to help digest fats and oils. I mean, there's so many things that occur with this. So what's really happening when they say you have too much stomach acid? It's not your stomach that's making too much acid. This is basically, you're eating food. You already don't have enough acid in your stomach. Your stomach is not producing enough acid. Now, there's many causes for that, whether they be neurological or the gut lining's damaged or a thyroid issue. There's so many potential possibilities noted in the research and in textbooks. It's crazy that doctors won't go to underlying causes with this. In fact, the number one cause in the United States of low stomach acid is a bacteria called H. pylori. But rarely do I see that ever tested for, rarely ever looked at. The thing is if I eat food and I don't have enough stomach acid, that food just sets inside my gut, inside my stomach, inside my small intestine. And the inside of our body is about 100 degrees. So that food quickly starts to ferment or rot. When it ferments, that changes pH. Now that creates bad acids and gases. So of course, now we can get reflux, heartburn. Those acids, our stomach lining wasn't built for those acids. Our stomach lining was built for hydrochloric acid. It does not cause symptoms. Now, if you get an ulcer in your stomach, if something is eaten through the lining of your stomach, then you can feel the effects of that acid. I mean, if you take stomach acid and you put it on your skin, that's going to burn. But our stomach, the cells in our stomach, the lining of our stomach is built for that acid. It won't affect us. It doesn't affect these areas. So if you get symptoms from this, you got to look for the cause. Now, taking these medications, even if you look at indications, they say, hey, don't take these for like more than 2 or 3 months, because they know long term this can cause something. Because if you aren't making enough acid, you can't digest and absorb minerals, proteins, and that's what we'll see on a lot of people's blood tests. Protein low, globulin low, bun and creatinine low. They're not digesting and absorbing minerals low. This can lead to osteoporosis, all kinds of problems from these medications. And if you aren't digesting food, you don't have food to absorb. So it all ends up in the toilet. And then you will absorb the sugars and carbs, though, especially the sugars, because they do not need stomach acid. And then, of course, that's going to end up causing a blood sugar problem, which most people who have these issues already have a blood sugar problem. So it just makes it worse. All right. So number 4, steroids. Okay. So steroids act kind of in a way of decreasing inflammation in the body. And people will go on steroids for many reasons, even with gut conditions. If a person has ulcerative colitis or Crohn's disease, a lot of times they'll put people on steroids to drop the inflammation down. But again, this can be used for not only just gut inflammation, but inflammation in other areas. Because what do steroids do? They suppress the immune system. So let's put it this way. If our digestive tract is 75% of our immune system, the lining in our gut is a big part of our immune system, and we suppress that. That may decrease some symptoms. That may decrease. Now the battle stops because the steroids have suppressed the battle. But you never thought about, why is the body fighting? Why is there a battle going on in the first place? What's the body trying to deal with? An infectious agent, a chemical, a toxin? What is going on in the gut? Why is the gut attacking, and what's creating this inflammation in the first place? You can drop inflammation, but inflammation always has a cause. And then what happens is that's why people can't be on steroids long term, because that can actually cause death. So again, steroids are used short term, but even at the same time, they're damaging the immune system in the gut, which is the gut. The gut, a biggest part of it, it's a part of your immune system. So again, it actually has been shown in the research to reduce what's called immunoglobulin A, secretory immunoglobulin A, and this is the biggest part of our immune system, especially in the gut, which is the biggest part of our immune system as a whole. And you don't want to just go in and shut down that immune system. You need to find the cause. All right. Number five is opioid drugs. So opioids are painkillers. Basically, they will most of the time stop pain, which can be great if someone's suffering, but at the same time, they affect the nervous system. So the problem is they're basically, our gut is a neurological structure. In fact, there's more nerve cells in your gut than there are in your spinal cord. So the gut, giant part of our nervous system. In fact, it's being called the second brain because it is such a big part of that. It does a lot more things than just digest food. And so if we shut down the way the nervous system affects the gut, what happens? The gut slows down. And one of the biggest factors that occurs with opioid drugs is constipation. So now if feces are just setting in your intestines and it's not moving, and that's happening day after day after day, week after week, not good. You'll start to reabsorb toxins. And now, again, you can try to take things to get the bowels moving, but over time, that's going to slowly weaken the muscles in the gut. The nervous system in the gut's not working. It's going to create all kinds of distension in the gut. I mean, it's just going to create problems. So again, now, not saying, there are some people who maybe just have chronic pain that, maybe need opioid drugs, but at the same time, the thing is to find out the cause. Why do you have pain? Why do you have inflammation? If you don't address that, you'll never get there. And then also they can be very addictive. All right, number six. Number six is antidepressants. Okay, now what does that have to do with the gut? So antidepressants, which are usually your serotonin reuptake inhibitor drugs, your SSRI drugs. There's a lot of these out there. Now, why do people take antidepressants? Usually they have a depression issue or an anxiety issue. So the thing is when you have those types of symptoms, yeah, you can take these medications. They make you feel better temporarily. The side effect lists are what you need to look at, which can be about a mile long. And also what happens is as you take these medications, your body will adapt to them. And then eventually they'll have to up the dose or change you to another medication after a while. So it's really kind of a road to nowhere because it doesn't help the cause of the problem. When you have an issue, when a person has depression or even anxiety, we have to say, what's underlying that? Is there something happening chemically in your body? Because again, the first thing you got to think of is why am I not manufacturing these neurotransmitters on my own at a good level, or why aren't they getting into my cells? Am I inflamed? Do I have deficiencies? Am I low in amino acids? Am I low in certain vitamins and minerals? Am I not absorbing these things? Or is there something going on in my body that's preventing the manufacturing of these neurotransmitters? If you don't figure out those issues, if you have a blood sugar issue or an anemia, totally going to cause depression, anxiety. So the thing is you've got to address these underlying causative issues. And if you don't, you can go on these medications and the doctor might say, hey, you just need to be on this the rest of your life. Well, you've got to say, well, why? Now, why is this occurring? What's going on? Now, also the frontal lobes of the brain. If the frontal lobes of the brain are not firing or firing slower, then this, of course, slows things down. Depression. So what could affect that? Fuel, blood sugar issues, anemia, inflammation, things like that. So we've got to look at what's underlying there, because these antidepressants, one thing to understand is about 70% of the serotonin in the body is manufactured in the gut. Interesting, huh? So the thing is if we start to change those that serotonin reuptake, we typically do it for emotional reasons, which affects the brain. But how's that drug affecting your gut? You change serotonin to the gut, you change the way the receptors are, you change the way the reuptake is of serotonin, you're affecting the gut too, and this can create all kinds of problems. So that's really never talked about. And now you're messing with something that is producing 70% of your serotonin. So very important to think of that way. And then again, to think of cause. Now, another cause could be maybe trauma. Somebody's had some type of emotional stress, emotional trauma in their life. Still, that needs to be addressed. Are there ways to not take these meds? Are there ways that maybe you don't need them? Possibilities. So think of it from a causative standpoint rather than just creating symptoms. We all want to feel better. We all want to feel good, but you can't ignore, there's too many risks to ignoring the cause because the side effects can grow. All right, what's the last one here? A lot of the people don't think of this as a drug, but it is. Alcohol. Oh, you know what? I didn't do a really good job of. All right. Alcohol. So alcohol is a drug. And, actually it's interesting because alcohol is probably one of the #1 causes of what's called SIBO, small intestinal bacterial overgrowth. So especially, again, excess alcohol. Alcohol can lead to ulcers. Alcohol can lead to B vitamin deficiencies, especially B12. Alcohol has all kinds of negative effects. And again, the majority of it is sugar anyway, so you're also can increase candida growth and so many things. It just has a lot of negative effects on the body. Now, people do it because it makes them feel better. It's an escape. It helps them sleep. I have many patients who come in who they do a certain amount of alcohol before bedtime because they want to be able to fall asleep because they have an insomnia problem. I don't blame them. They're wanting to sleep. But at the same time, we've got to look at the cause because you can't go on that way for very long. Alcohol definitely has its detriments. Everybody knows about that. And don't get me wrong, having a glass of wine every once in a while or drinking some alcohol every once in a while, it's not going to kill you. And it's not the worst thing in the world. But at the same time, regular consumption, daily consumption, even weekly consumption can be a problem. So, and especially the preface of all of this that I'm talking about is if you already have a health condition, if you have a chronic health condition, chronic health problem, an autoimmune condition, you're who I'm really talking to. And if you're doing these things, we've got to say, what's underlying this? What's causing this? All right. Otherwise, you just keep taking things. And that's the thing that I find is many times doctors just tell your patients, like with the PPI drugs, oh, it's just something you're going to have to take the rest of your life. No, and even the indications say you can't do that. So again, a very, very interesting stuff. I hope everybody's enjoying this today. Let me just, I've got some comments here. All right. I've got Amanda saying double whammy for me. Hi, Amanda. Long-term steroid use. Yeah. Strip the lining of your stomach. Now you're given a PPI, can't tolerate the side effects, stuck in the loop. Absolutely. And that's the thing is with an autoimmune condition, the thing is to find out the cause, because from a conventional medical standpoint, autoimmunity is just thought as, hey, my immune system is just willy-nilly attacking me. We don't really know the reason it's attacking you, so we've got to suppress the immune system. Well, I disagree, and that our theory that we see work with our patients is that the immune system is attacking something, but it's something that doesn't show up on your standard blood tests or other tests. So that's why we have to dig deeper and find out, what is the immune system attacking? Is it a heavy metal, a chemical, an infectious agent? Why is your immune system on red alert to attack you and a certain organ or area? So again, it's finding out what is underlying this, getting rid of these things so the immune system can calm down and stop the attack. Otherwise, being on steroids long-term, it's just so much damage can occur. Can that damage be reversed? Maybe, maybe not. but hopefully to a big degree. But yes, it just leads to another medication, another medication, and another medication. And it's just kind of a road to nowhere. Good comment. I really appreciate that, Amanda. All right. And then another comment here from Jeannie on what about like benzodiazepines? So same thing. You got to look at cause. Now, I would say from a neurological standpoint, once you take a benzodiazepine drug, you've really kind of changed the brain to a degree forever. Can you go back? Some people can, some people can't. And but the thing is they're doing these usually as more of an anti-anxiety effort, and it's just kind of a medication that is used. But the problem is it's looking at these other factors. How can we increase serotonin? How can we increase GABA to the brain? And another one you mentioned there too, alcohol disrupting sleep. You're right. Some people it does. Some people, they drink alcohol and it keeps them awake. Some people it knocks them out. Definitely though, alcohol may put you to sleep, but you usually won't get a deep sleep. It'll be superficial. So good point there too, Jeannie, with alcohol. Yeah, it can, over time, it can disrupt it worse and worse. And then Linda, that's why they told me about the PPI drug. You're absolutely right. All right. Well, I appreciate everybody watching, and I really appreciate your feedback. Some great comments today from everyone. I do ask that you share us on Facebook and YouTube and Twitter and all these things. And I hope you enjoyed today, and I hope you guys have a wonderful day, and God bless. I will talk to you next time.